I'm Debbie Statler, Editor-in-Chief of Provider Magazine, and today we're here with Mark Parkinson, President and CEO of the American Healthcare Association. Thanks for being with us.
That'd be great to be here with you.
Well, what are the top legislative and regulatory concerns and priorities for long-term care right now?
Well, the really good news is that we're coming out of the pandemic. Really, since after the first year, providers have done an amazing job of keeping people in their buildings healthy. But we're still working our way through the business recovery. Census is not completely back. We're still 3 or 4% short of where we need to be. And even more challenging, we're hundreds of thousands of workers short. And so at ACA-MCAL, we're doing everything we can with our state associations to try to help with the workforce issues and at the same time try to keep negative workforce ideas like a minimum staffing mandate from occurring. So we're heavily focused on workforce. We're heavily focused on continuing to help members get the reimbursement that they need to make it through this.
Well, workforce challenges is something we've been hearing from almost every provider. It's still such a challenge for facilities. How can we advocate for better legislation and regulation at the state level and at the national level?
Well, I feel like there's a really good understanding now from the policymakers and about how bad our situation is. We have such a massive workforce problem that they're hearing about it from their constituents. They're going to town halls and meetings and hearing about the lack of nurses and people working in all kinds of healthcare, but particularly in our buildings. So convincing them of our problem, we're over that. So then the question is, what do we do about it? And that's where it gets really challenging. The best and simplest solution would be an immigration policy. We can't get them to do it at the federal level. It's become too political. Both sides, the extremes of both sides, want to use an immigration bill to push all sorts of other stuff. And so we're having to kind of work around the edges to improve the situation. We've been working with the administration to streamline the amount of time that it takes once someone is basically approved to get over here. We've had a lot of success with that. We've been talking to them about creating incentives for people to work in our buildings, but the low-hanging fruit is gone. What we really need now is we're going to need some help with immigration. We're going to need some help with reimbursement so that we can pay wages that will attract people into our buildings.
Absolutely. Well, two bills have been recently reintroduced into Congress: the Building America's Healthcare Workforce Act and the Ensuring Seniors Access to Quality Care Act. How will those bills help our industry, and then how can providers get behind them and offer support?
Yeah, well, if we could get those two bills passed, we'd be really ahead of the game. The first bill extends the temporary nurse aid program, which I'm super proud of. ACA created that program. Our clinical people were smart and said, hey, we're not going to have workers during the pandemic, so they came up with the idea. They pitched it to CMS, and CMS said, hey, if you can get the states to do it, fine. Over 300,000 people took the TNA training. I think over 200,000 of them ended up working in buildings. This legislation would extend it for another 2 years. It'd be a game changer. The other piece of legislation gets rid of a ridiculous policy that's in statutes that says that if you have a deficiency that's serious enough, we're going to stop your CNA score. And unfortunately, because deficiencies are so subjective, but there are surveyors that I can tell you from real experience give them when they're not deserved. We've had the closures of a number of CNA training programs when we need more CNAs right now. So passage of either of those things would be a game changer. If you go to the ACA-MCAL website and look at the government web page, we have tools there where people can get involved and help us out with that.
Excellent. Well, there has been much discussion about the possibility of a federal minimum staffing mandate for nursing homes. What is happening now, and what can we expect in the near future?
Well, the fresh news is that CMS just sent this proposed rule over to the White House. That's the last step that happens before it becomes a proposed rule, not a final rule. It will be proposed. We think it will be issued sometime in the next 2 weeks. We will then have 60 days to respond to it, and we need every single member to respond. Our goal is to have 10,000 comments between the date the rule is issued and the end of the comment period, which is only 60 days. So we'll be having webinars explaining people how to submit comments. We need one or more comments from every single building. We don't know exactly what's in the rule. But we do know that for the last 9 months, we've been working very hard. It's been our top priority to encourage CMS to make this rule as reasonable as possible. You might say, how could it possibly be reasonable? Well, even if the number is bad, let's say it's 4.1 nursing hours per resident day, which is not an achievable number, the workers aren't out there. If the components of the rule, like what workers count, or whether there was a waiver if you just couldn't find workers, the length of the phase-in, whether it's paid for, what the penalty is, all of those things matter a lot. So the day the rule comes out, we'll get a notice out to every member saying, here's what's in the rule, here's what needs to be changed. But for the next 60 days, we need them to step up and help us with comments, and we'll hit our goal of 10,000. We're going to eventually win this, I think. We're going to either shape it to a point that it's livable, or we're going to defeat it completely. But we're only going to be able to do that if everybody pulls together and helps us fight this thing.
A facility tour is one way that providers can engage with legislators and really tell their story and build those relationships. What are some other ways that providers can build those relationships?
Well, I'm going to start with facility tour, even though you've asked me for some other ideas, because I think that facility tours is the single most effective way to really connect with the legislator. First of all, the residents love them. You know, we would bring our state legislators in. Some of our residents would get dressed up. Yeah, I mean, it was just, it was really, really fun for everybody. The reason it's so important to get members of Congress and state legislators into buildings is that, first of all, they need to see the passion that we have for our residents. They need to see that relationship that's there. They also need to see our residents. There is a common theme from both parties that we have all these residents that are living in our buildings that could be living at home. That's not true. The people that live in our residence are very old and very frail, and it's just powerful for legislators to see who it is that we're actually taking care of. So I would encourage legislative tours. Matt Smith runs that department at ACA NCAL. If you want to have a tour, just let Matt or me know, and we'll set it up, and it's really, really helpful. Beyond that, you know, getting involved in a campaign is really helpful. Whether it's at the state legislative level or at a congressional level, they all need help. And so getting involved in that is helpful. Coming to DC with us, you know, it's super exciting. We're out here right now for congressional briefing. We've got 500 plus folks out here. We'd love you to come into town. Even when it's not congressional briefing time, we can take members around and show them, you know, introduce them to their members of Congress, et cetera. So just spending some time on it. And then what happens is people start to develop real relationships. A trust level starts to develop between the legislators and the providers, and that's when we can really get things done.
There's really no substitute for that firsthand experience, that connection that you build.
Right. I mean, we can send hired lobbyists out to talk to these members, but nothing's more powerful than to have an actual caregiver come in and say, look, here's the real deal. Here's what's really happening.
And they want to hear from their constituents.
Yeah. Absolutely.
Well, thank you for spending a few minutes with us today. We appreciate it.
Sure, it's been fun.
Thanks.